you want them to be able to, what you're going to do is just squeeze the calf or the gastrocnemius muscle group, and you should see plantar flexion when you squeeze. All right, so yeah, plantar flexion. Can you see that? It's not a lot, but he's good. So if you get nothing, that would be a positive sign. Very simple, right? Okay. So what does this look like that you've already learned? Right, so this is, the other name is the Thompson test, probably the most popular Thompson, but that's for the Achilles tendon. Homans is testing for what? DBT. Is that a good test? No. So if you were testing for a DBT, you would look for what? Pain, redness, swelling, hitting edema, right? All of those things. It can be painful to palpation in the central mid portion of the calf, but you're going to use what to assess for a DBT? Wells what? Wells criteria. So you have a clinical decision guide or clinical decision rule, and you use the Wells criteria. What are some of the questions you would ask the patient in the history if you're thinking of the positive, you give them a point more than 3? Do you remember what they are? Previous surgery or immobilization. Cancer, history of cancer within the last 6 months, and current treatment. Yep. Anything else? Immobilization, surgery, cancer, those are the biggies.
Cancer or surgery.
Previous DBT would also factor into that. Also a fracture, large bone fracture, like femur fractures are big. Okay. All right, good. So that's Homan sign, but also the Thompson test. All right. Can I keep going?
Yes.
I think y'all are pretty good with squeezing the calf. The next one is a figure 8. Can I use you again? All right. Go ahead and sit up. You want the patient to be in a position where the knees are flexed to 90, so you hanging over the edge of the table. Very comfortable there. And I want the table high enough. Is it working? Plug. Yeah, well, that helps. Plug it in. It wasn't for you to do that.
You had the right one, Jesse.
Yeah, it's
That was right. It's just hooked.
What? Because I want you to be able to see it, and if my head's over it, then I can see it. So with the figure 8, this is a good test for measuring what? Swelling. Oh, you did this, right? 560? No?
We've seen it just redundantly. Yeah, some of this when I
Maybe on your clinical, maybe. Okay, got it. So, yes. Can you, this is where it's going to be. Can you scroll in a little bit closer so they can see the ankle? Okay, so one is knee at 90. And this is a good test in terms of reliability. Okay, and it's in terms of very good reliability, but you have to use the specific points. Okay, so I'm going to highlight those. You want to start at a point where just between the lateral malleolus, so you can find that, and then the tibialis anterior tendon. So you can pull your foot up for me, and you can palpate the tibialis anterior. So midway between there is basically, relax, basically where the anterior talofibular ligament is. Okay, so that's the way I remember it. So that's the starting point. If you remember the starting point, and then you remember to go medially, you can't really screw this test up. Okay, so you start near the anterior talofibular ligament, and then I'm going to do a figure 8. My next point that I'm gonna find is the navicular tuberosity. Okay, so that was pretty easy to palpate before. So here's his navicular tuberosity. You just have to trust me. You're gonna go right at that, slightly distal to it, and then you're gonna find the tuberosity of the fifth metatarsal and go just proximal to it. Okay, everybody with me? Now, in order to make your 8, you just come up and around. You find the distal aspect of the medial malleolus, wrap it around the inferior aspect of the lateral malleolus.
Inferior aspect of both malleoli.
Yep, inferior aspect of both malleoli. And then you get your measurement, okay? And then you do that 3 times, okay, to get an average. So there's your figure 8. Everybody good with that?
Did you say inferior to the base of the hair? We just do it all the way through one more
Yep.
time.
Sure. No, it's proximal to the base of the foot. Yep. But, so it's midway between the tibialis anterior tendon and the lateral malleolus. You want to go medially, just distal to the navicular tuberosity, okay? Then you come up just proximal to the tuberosity of the fifth metatarsal, so there. And then I'm gonna make a figure 8 by going distal to the medial malleolus, and now distal to the lateral malleolus. Make my measurement there. Record that, and then do it 3 more times. 2 more times. Okay. Right. Gonna practice that one? You all have your tape measures, or you want to keep it? You probably don't have your tape measures. I tell you what, it would be a good idea for you just to palpate the points you're going to put the tape measure on. And at least try to, why don't you draw it? That'd be a good idea. Draw it. If you don't have a tape measure, draw it.
I know.
Do you have one?